Hi, this is Dr. Rachael Coleman with Be in Health. Sit back, relax, and enjoy today's health and wellness topics. So Ed Sax Thomas is an accomplished inspirational jazz saxophonist and versatile musician with nearly 40 years of experience. He's played solo with large gospel choirs and small jazz ensembles. Give it up for Ed Sax Thomas.
Somebody said, okay, somebody know that. That's old school. She grew up in Washington Jr., Mr. Magic. Come on, y'all.
He is a phenomenal physician and an extraordinary individual. When I first met Dr. Caldwell, we were both doing rounds. I'm not sure if he remembers this, but in Northern Kentucky at a hospital that was formerly part of the Health Alliance, and he kindly introduced himself. And I remember he spelled his first name because I kept getting it wrong. And then years later, we were both part of First District delegate to the Ohio State Medical Association, the General Assembly, and during a break, I was sitting next to him, and he kindly shared of a medical office that was in need of a physician to help with addiction. I was already waivered, but I was not working in addiction, and he helped me make the connection with Dr. Cooper. And the rest is a little bit history because I'm now board certified in addiction medicine, but that was because of Dr. Caldwell. And he was working there as well. And I found out that he was doing Toastmasters. He hosted Toastmasters. So I sat in and participated in several sessions. But he's truly amazing and extraordinary. And this year, he is celebrating 60 years in medicine. Let's give it up for him, 60 years. In addition to that, he's a Korean war veteran, and he's also a pilot. So let's give it up for Dr. Caldwell.
Got a lot of high accolades there, Dr. Coleman. And I could reverse that too. She's quite a lady. My background, she mentioned some of the things, and I've been in medicine 60 years coming June. So I'm an old guy. I've been here for a long time. I watched a lot of stuff happen in medicine. I want to talk about I'm talking about a subject that's a little tricky, and I'm a little bit more into audience participation. I want to talk about erectile dysfunction as a fancy name for it. And it's a general audience, so I'll be a little sensitive about how I express things. But it's an essential function for the continuation of human beings. Without sex, no babies. And what we're going to talk about today is the mechanics of baby making. the importance from the male perspective. The things can go wrong, how it works, how to fix it. Basically, for a man to participate, there are a lot of things that have to go right. All the way from the head to the nerves in the body, hormones have to go right. Hormones in the whole body, hormones locally and in the genitals. All these things have to go right in order for you to be strong and complete the act of making a baby. Now, what can go wrong? All kinds of things. Starting from things work reasonably well, but too well, and it's done before you get there. It doesn't get into place it's supposed to go. That's a mistake, and that's a problem. There's a fancy name for it, premature ejaculation, but that's a fancy, that's my $35 word. That's a little bit more expensive. Then the guy that on the other end is where afterwards it won't go down. That's called priapism. It's another thing that happens. And all the things in the middle. Most guys, the vast bulk of guys, are concerned about it's got to get strong enough to be able to go into the place where it's supposed to. And all the different kinds of things can be just a little bit, can be nothing, can be almost there, not enough. All those things can happen. Today, we're going to just talk about that particular part. That talk about going too quick, that go by staying too long, but all the processes that are required for the organ to get in a proper state to make a baby. Okay, I brought a whole bunch of notes and things, and we can talk about it a little bit. From an epidemiological standpoint, this Massachusetts male aging study asked a bunch of guys if they had a problem. Half had a problem somewhere in the issue. Somewhere there was an issue. Now, to make the diagnosis of failure, there's an outfit called ICDM. It's a fancy thing for what you have to do to make the diagnosis to put it on for the insurance to pay you for it. And there are about 4 things. One, between 3 3/4 of the time, there is failure. Second one is it has to be greater than 6 months. You have to try for 6 months. And it has to cause the man some problem, head problem. And normally, when you have this problem, a guy will see me first, but sometimes you want to see the couple. You want to see both. Because typically, we have all these alphabets, and there may be a little bit of variation with the LGBT people. But the problem's still the same. And you want to talk to the person that they are intimate with, because there's a lot more to it. So let's talk about it just a little bit, and talk about some of the things that happen and some of the ways that I would approach it. Okay, there are a couple of things when guys say, I have never had any problem. Okay, you get older, because the problems tend to, the number of people who have a problem tend to increase as you get older. You know, I'm an old guy. It's 85, not 84. 85. Yeah, right. Maybe a year younger. Maybe I should say thank you. Knock up there. You look young. I lived it though. I lived it.
You look young.
Yeah. Thank you. You know just what to say. Okay, so I thought we talk about a little bit about the various aspects of it, and talk about some of the causes and some of the things like that. The big one, when a person comes to see me, when I still practice, but not much. Couple half days a month, and I'm looking for more, and I would be glad to work some more, but I got to find another job. Somebody will hire an old man. Anyway, the first thing you want to find out is to find out look specifically what's happening, and there are all kinds of things that get in the way, because what makes this action happen, all kinds of things in the environment. Guys who are down, sad, mad, lost a job, whatever, those problems can interfere. There can be other things that interfere. Some people, all kinds of things can be present or not present, can be positive or negative, like vision, the things, other person, something's changed. that click turns things off. Other things that happen, odors, conversation. Those are things that stop the stimulation. And so when I talk to a young man that comes in, really tragic, and I have to tell you just before we start, all these things, I've cheated a lot of times. I've cheated a lot of times. In my life, about 30 years ago or so, something like that, they came into existence a little blue pill that fixes a lot of stuff. Um, that was a really interesting story, and if I have time, I'll tell you how that came about. It was a really interesting story how that came invented. It wasn't designed for that. Okay, I'll tell you anyway. What happened was that Pfizer had this product they wanted to fix hearts with, like nitroglycerin, and so they started marketing this pill, and it was called phosphodiesterase 5. It's a fancy name for it, PDE5. But there was a bunch of them, and they took it off the shelf, and they tried it. And what they wanted was when a guy feels my chest, like in was it Jackson, the guy, the comedian who used to,
Fred Stanford.
yeah, Fred Stanford. It's happening. Martha, I'm coming. That thing happens. Your chest starts hurting. You take nitroglycerin, and nitroglycerin will open it up temporarily. You still got to get it fixed, but it'll open it up. Anyway, they thought they had a medicine like that. They were marketing it, but it didn't beat the stuff that's on the market. So they said, okay, well, it didn't work, so we called all the pills back. They asked for the pills. And guys wouldn't give them back. Guys wouldn't give them back. Say, oh, want back. Give me some more, man. What the heck's going on here? Well, they found out that it fixed the power. That's Viagra. That's how it started. Yes. And so they did all the studies. They went back and they fixed it. They went back and did a few little things, and poof, it's on the market. Pfizer stock went off the chart because that's a really popular pill. And I have to say that when I see people, normally I cheat. I might give them a couple of them and see if it works. Because if it works, poof, I have to do a whole lot of workup. I have to do a lot of studies, just give them that little pill. And some guys, they take one, they didn't really get cured. What happened was that they had another problem, and it fixed their confidence. They were going, you're in a situation, an intimate situation, and your member won't respond. It doesn't do anything. Lord, that's embarrassing. And you talk about a man's ego. Boy, his ego is really messed up. And he got somebody mad at him. So every time he goes back, if he gets an invitation, that problem's going to compound. And so you give him that pill, it works. It's like placebo or whatever, it works. That one time he got his confidence back, now he's ready. And the next time it'll work for him. That's the ideal guy. He may be 35, 40, something like that, young fellas. But then there are the guys where it doesn't work. And we'll talk about that a little bit. But that's the easiest thing. Now, there are all kinds of things that can cause it. And if I have to, I will go into that because it's easy. There are a bunch of things that are fixable, like their blood pressure medicine. It's associated with a lot of things. That is, the incidence goes up with a lot of things. It goes up as you get older. It goes up if you have diabetes. It goes up if you have high blood pressure, if you have high cholesterol, if the hormones from your genitals, the testosterone's not there, it goes up. Interestingly, with that one, though, is that you don't really need the testosterone. Your testosterone, you can have no beard and all kinds of other things from the lack of testosterone, and your member still works. There's some really interesting conditions, there's some conditions where it happens. Now, there have been studies where they used testosterone and Viagra at the same time to try to give power. They didn't need the testosterone. Most of them didn't. I guess occasionally there's a little bit of few people who wear that work, but where you need the both. But a lot of people, they did. It was not the testosterone. Anyway, so you don't really need that. Testosterone does make your member grow, and there's a condition, sickle cell anemia. You've probably heard of it. That's an area that I studied a lot. I took some extra training and I used to treat that a lot. So one of the things there is that you see guys with no beard and the build is kind of don't have much muscle, and you give them zinc, which fixes the testosterone problem. It's complicated, but you make their body make testosterone, and they grow. I had one kid who was 25 pounds of muscle just in a few months from increasing his testosterone. Well, I'm off on a tangent there, and I got lost in the tangent. So we'll go on. Other things that cause it or that are associated are cholesterol, thyroid disease. I mentioned earlier when I said the guy is feeling real down, that's depression. Normally when a guy, his mood is bad, he wants to cry all the time, feels real sad, that's depression. And so you can treat the depression. Now, occasionally with depression medicine, though, is a problem where you just won't shoot. It's another thing where he does everything and time-wise going on and on and on, and no delivery of sperm. Okay, malnutrition does it. Malnutrition is one of the things that I talk sometimes with sickle cell disease that they have that too. And sometimes you can have physical problems that are problems, that carrot thing they talk about on TV, Peyronie's disease, where remember, instead of being straight, crooked. Well, if this is the shooting end and this is the end, and it's bent like this, it ain't gonna work. You can't deliver. Matter of fact, you might not even get it in the place to deliver. Okay, that's the disease they talk about where Peyronie's disease is crooked. I think just in past. Oh no, can't say that on the air. Okay, okay. There are other kinds of nerve diseases and all kinds of things that will do that. And then there are the medicines. I mentioned one. Some blood pressure medicines, some diabetes medicine. There's one medicine that we used to use for ulcers, peptic ulcers, that are sometimes associated with it. When I say these medicines can sometimes associated, if I was taking care of you, you were taking one of them, I would stop it. If it worked, good. But if you look at numbers of people, thousands of people on it, only some of them will at work. A lot of them, the medicine isn't related. Stop the medicine, nothing happens, so I put it back on. Then I look for the other things. So I look for all these long numbers of medicines to see what drugs they're taking. There's some that are really notorious. The ones that prostate disease sometimes is associated with it. I think somebody mentioned something about that. But anyway, prostate disease of various types are sometimes associated with inability to start. It won't work right. And some of the medicines that you use to treat it so that they can pee right. Because one of the things with prostate disease that every man gets, the prostate swells up. And that's a whole nother thing about how prostate disease works. But normally, if you have a beard and if you have a beard and you're a man, you have a prostate. And if you live long enough, that guy's going to swell. Okay, and when it starts to swell up, it's only a problem if it swells, there are 5 lobes, and only the one in the middle, where the tube goes to pee, if that swells up, it blocks your water, and you have to fix it. All the treatments for prostate disease, too fat of prostate cancer, all those things have some incidence of guys not being able to perform. Okay, there are a couple other things that are interesting. One of them is the blood supply sometimes gets affected. Oh, and there's one other thing that happens. When the guy comes in to see me, normally, this is just one of the things. And if it's having that ability, sometimes it's associated with other things like heart disease. Okay, well, you go and haven't done anything for a few months, and you go in and you try, and your member works, your heart may not be able to keep up. In which case, you might have, Martha, I'm coming. You may have one of those, you might have that sudden chest pain that's a problem for you. So I normally would check that before I would, old guy, or even some young guys, before I give them the little blue pill or whatever else I might do. I'm going to make sure that they're not going to go to heaven trying to get to heaven on earth. Sorry about that. I couldn't pass that. Anyway, the same process, though, that causes a heart attack, closing of the blood vessels, can close that blood vessel. In which case, the blood doesn't get in there. Because what happens is is he's full of blood. My man, when he stands up, is full of blood at high pressure, up to 200 milligrams, 200 millimeters of mercury.
Yes, sir.
Dr. Coleman mentioned high blood pressure is more than 100, 140. 200 that guy has in him. Anyway, he's pretty rigid. That's why he works. Okay, but anyway, when the blood can't get in there, that's one of the causes. Now that's a little different. Okay, I talked to you a little bit about causes and about how it works and what happens. Let's talk a little bit about when the little blue pill doesn't work. Okay, first thing I would do would be to find out all those different diseases that might be a problem. Start off with the drugs, start off with all kinds of things that might be a problem. The big one would be heart disease and diabetes or whatever. I'd look for all those things first and see if I can fix them and make them better. Now, failing all those things, everything I do doesn't work. Okay, now, the little blue pill didn't work. Okay, that's rare. You know, most guys, whatever the problem, the little blue pill will work. But when it doesn't, there are several things that we can do. There's one where you can take a little teeny-weeny needle and inject a man, and things will work. Guys are a little bit squeamish about injecting that particular part of their body, and so that might be a little trickier, but it works. Okay, the second one is there's a thing called a Muse, M-U-S-E. That's similar. Oh yeah, you had that one too. I'm gonna get to that one. Yeah, Muse, you stick a suppository, a little gas, some medicine down in him, and the medicine will make things work. Okay, and then Mr. Young was just mentioning to me, there's another one, a vacuum pump. That you put him in a vacuum, seal it up. It's got a little grease around the bottom, and you seal it up, and you put this vacuum thing on it, and it will bring in blood into it, enough into it for him to perform. Now you have to put at the end of the vacuum, there's a little gadget that you put as a ring at the bottom that stops the blood from going out. So you get the balloon all the way tight as you can, and you stick this little thing on the bottom to hold the blood in there, and perform, to take everything off, and you're good. The last thing that's done is surgery. There's prostheses or little things that you put in my man, and they are rigid. They're just like this thing. They're rigid, and there are two types. There's one that you bend down when you don't need it, and bend up when you need it. That's a rigid one. The other one is a balloon, and there's a gadget inside, a pump that you can press that little pump or a little switch, and the balloon will blow him up. I mean, the machine will blow him up. And when you're finished, you turn the machine off and fluid goes back out. It's kept in a little reservoir, the fluid inside the balloon's inside. Okay, I've talked a lot about this stuff, and I kind of beat around the bush a little bit. I hit a lot of things, though. And I'll take some questions. You guys have questions or think? Yes, sir.
Isn't it beyond Viagra?
Yeah.
Excuse me. Let me go to the crust.
Yeah.
The crust of it all is blood flow.
Yes. Well, it's blood going in and not coming out.
And not coming out.
Yes.
So the crust of it would be, or the nature would be, is for us to get the blood in.
Yes.
And to gorge the.
Yes, that's what happened. That's what happened. Yes, engorge, yes.
The heart is directly in line with pumping that. So the heart is the pump.
Yes.
And the blood is like the hydraulic fluid. Yes. If I might term it that.
Yeah.
And then the cylinder would be the male action.
Right.
Okay.
Right.
So if the check valve is left open permanently when it's being pumped, there's a check valve that opens.
Okay. Oh, right.
That blood comes through.
Right. But that's the normal. The check, there's not a valve that blocks it going in.
Okay.
The valve is blocking coming out.
Okay.
So that the valve, the check valve is on the way out, not on the way in.
Okay, so not on the way in.
Not on the way in.
So the blood flows in uninhibited
all the time. All the time.
Okay, so the problem is getting it from here to up here.
Yeah. Now, you know, if there's disease, like the disease of the heart, where the artery, the blood vessel.
So if I got a clogged artery.
This artery is clogged, then you won't have the blood to get in there.
Exactly.
That's disease.
Okay, so it may come back to being a heart issue rather than being.
Oh no, the same disease happens. Little blood vessels in both places, in the brain, the kidneys, the legs, everywhere, and you can have blockage in any one of them. So it's the same disease, but not. They're different places.
Now, and then my second question is, I mentioned pitching in the ballpark.
Yes, sir.
As we get older, we're not pitchers. We don't throw
Yeah.
no hitters anymore.
Yeah.
And as we get older, this is what life is all about.
But you learn to maybe not be hitting the home run. First base is good.
Okay, well, that's what I want to get to.
Yeah.
As I get older,
Yeah.
I'm not able to stay in there 9 innings no more.
Right.
I'm only good for a couple of innings.
Right.
Then I got to call a relief pitcher in.
Well, one is good. Don't call it relief though. Just go with, don't call it relief for him.
Okay.
Just go for the one.
Okay. So as I get older, I'm not going to be able to pitch.
You're right.
I'm
You're
not
like
gonna be able to pitch no 9 innings.
but like everything else, just let's compromise.
Right.
Well, let me tell you, it's better to be live and hit one than
And then not hit nothing.
exactly.
Okay.
Yeah. So you
Now,
get old.
As I get, well, I know it now. As I get older, is it the appetite? Is it in our minds that we get slower to the appetite?
Everything gets slow. Like you were saying, you're not lifting the same amount of weight
No,
you
I'm
lift.
not.
Yeah. I like to do. I'd like to do those fancy push-ups where you clap your hands.
Right.
I quit for a while, and now last few weeks I can't do that anymore.
No.
Okay, well I can't do that anymore. So hey, but now I'm trying. I still do it. I started doing it every day, see if I can build it back. But you get older and you don't do the same thing.
So I can't swing from the chandeliers no more.
No.
Put that Taurus suit
But what you want to do is keep swinging.
Keep swinging.
Yeah, right.
Well,
My question is that do you are there any negative side effects to
Yes,
any of
sir.
those things?
Yes, sir. Yes, sir.
Whether it be the pump
Yes, sir.
or the
Yes, sir. Yes, sir. Anything that works in somebody's body, it'll do something bad. Everything that works. The reason that you use it is because way more people get the benefit than have the problem. When people start having a problem more than having benefit, you can't use it. There are a lot of medicines like that. Or even if the number of people who have a problem starts to rise a little bit, if it's a serious problem, can't use it. We said some time ago, my favorite is a drug we had is really wonderful. Take that drug and, you pop a pill, the appetite went away. People were getting skinny. They were really, because obesity is a really big problem. And it was working for a lot of people. Somebody took an echocardiogram of a heart and found some little growths on the valve. Man, that pill was off the market so fast, one day everywhere, next day you couldn't find it.
I know you want more, but that's all for now. And until next time, be in health.